faces, yeah. We're back here on the Lynn Hayes Freeland Show. We're talking about strokes. It is an important subject, in particular for our community. But one of the things that I just learned in the commercial break, age has nothing to do with it. Here to continue our conversation, three individuals, three perspectives. Dr. Jennifer Shen is an assistant professor at the University of Pittsburgh Department of Physical, Medical, and Rehabilitation. Dr. Christine Paul, now I don't even know what this means, ABPP? But she is a rehabilitation psychologist at UPMC's Department of Physical and Medical Rehabilitation. And Kathy Seiler is the stroke program coordinator at UPMC Mercy. Welcome to you all.
Thank you.
You can tell me what those letters mean in just a minute. But let me start with you. And I mean, we've talked about Audra, we've talked about how her life, her family's life has changed. The one thing we haven't done is really defined what a stroke is.
Sure, and a stroke is basically, it's a non-traumatic brain injury. So usually the issue is that there's some disruption of blood flow to the brain, which causes that brain to be injured. So it's actually not too dissimilar from a lot of the ways that heart attacks work, in that there's a blockage in a blood vessel. That's the most common mechanism, and whether it's a blood vessel feeding the heart muscle or the brain, when that blockage occurs and the heart muscle or the brain doesn't get that oxygen, then there's damage.
Then there's damage. And I see the commercial all the time that the faster you get to the hospital, to the ER, the better the outcome is going to be. Talk to me about that. You're looking at her.
I can talk about that.
Yeah, either way. Yeah, when it comes to, there's a saying that time is brain. So especially in the realm of stroke and all the new medical advancements and technologies that are available, the sooner that somebody can get into medical attention, the better their outcomes are. And so in fact, the American Stroke Association has, they cite that stroke is now the 5th leading cause of death in the United States.
Wow.
It used to be the 4th, and that's because there's more advancements and people are more aware, and the entire healthcare system is more streamlined to try to get people that help as soon as possible.
And Dr. Paul, talk to me a little bit about what that help is. I mean, we can talk about the ER, but I'm guessing it doesn't stop there. It's that continuum of care.
No, certainly the continuum of care. So, when individuals come to the post-acute rehabilitation unit at our hospital, we focus on treating the whole person. So we have a multidisciplinary team. So as Dr. Shen had mentioned, she's a physician on the unit. We also have a physical therapist to help with walking, ambulation, an occupational therapist to help with activities that you might have been able to do, but you realize you can't do now or you need assistance with. For example, bathing, dressing, grooming. You have a speech therapist who will help with difficulty with speaking, cognitive changes, and then also difficulty with swallowing, because that is common after a stroke. You have the nurses, you have other therapists, and then also myself. So part of my role as a rehabilitation psychologist is not only looking at some of the cognitive changes, but also focusing on the adjustment to disability and looking further into assessing for depression or even mood or behavioral changes following the stroke.
I was going to say, and I'm guessing some of that it may be more difficult than the physical.
It can be, certainly. I think Audra, as she was talking, and as you asked her to walk her through the day prior, she said it quite eloquently, for all stroke survivors to go from one day being as active and as independent as they were, all of a sudden experiencing a disabling illness, and then being in the hospital where you may need assistance standing, walking, bathing, grooming, dressing, Again, there's going to be a period of an adjustment.
Absolutely.
That is normal.
Absolutely. And so then, Kathy, when we talk about all of these needs, if you will, as one goes through the process, I'm going to guess that's where the support system, not just your family, but outside services comes into play.
Yes. I actually facilitate a stroke support group, and we meet monthly. And at that stroke support group, that's actually how I really became great friends with Audra. She attends those support groups, and we bring speakers in. I facilitate. It is the group that asks me to present what they want. And we've had, actually Tina Paul has spoke. I've had people come in talking about services that can, but more importantly, the people who are there who are stroke survivors, they often have key information that they can discuss with each other. So we meet for about 2 hours. We have like some type of a little bit of a breakfast and speaker, interact with each other, socialize. We have a Christmas party. We also have a stroke camp. We've had this for the last 2 years.
I've heard Audra talk about stroke camp.
It's phenomenal. Audra was doing a rock climbing at the stroke camp. We have volunteers. Dr. Shen and I have been there. Tina has been there as a volunteer. And it's the UPMC Stroke Institute and the UPMC Rehab Institute actually helped fund the stroke camp for the last 2 years.
Okay.
We have had great outcomes of people wanting to attend, to the point where we've had 1 stroke camp in the last 2 years, and we're trying to get 2 stroke camps because we've had a waiting list of people.
So many people.
Yes.
Which then leads me to this question, and I'll put this out for all 3 of you, whoever wants to answer, because so many of the health-related issues that we talk about on this show, there's a stigma attached. People don't want to talk about mental health. They don't want to talk about HIV. They don't want to talk about all these things. There's a stigma. It doesn't seem to me that stroke has that issue, or am I wrong?
There certainly can be a stigma related to surviving a stroke. I mean, it is a disability, and you know, again, it's a very individual perspective. Like I mentioned before, to go from all of a sudden, you know, being functionally independent to having a disabling illness is an adjustment, and people adjust, in several ways to that.
Okay, all right. 2 questions. I want to talk to you, Dr. Shen. You mentioned to me in the commercial break that age is not a factor, and we tend to think as you get older, your odds change.
Sure, and there's a number of risks, right? So advanced age is a risk factor for stroke, as well as things like uncontrolled diabetes, blood pressure, cholesterol, diet, you know, all those kinds of things. But stroke knows no age. So we know there's infants who suffer strokes, and there's somebody in my extended family who had a stroke even in utero, so before he was born. So there are no bounds.
So that age thing in large part is a myth.
Right.
And Kathy, you picked up on this when I was talking to Audra about the signs. There are some things that all of our viewers need to be aware of.
Yes, it's called FAST. It's an acronym. Face, facial droop. Arms, do you have weakness? Is it drooping down? Speech. Audra had said she was confused. Oftentimes it's not confusion, especially on a left-sided stroke. Your brain knows what it wants to say, but instead of saying glasses, she can't pronounce that word glasses, so she might call it the napkin, and that's an aphasia. And many times family members will say they're confused. They're not confused. They know what they want to say, they just can't get it out. So that's speech. And time to call 911. Every minute you delay, 1.9 million brain cells die. So that's really important. We know stroke is now the 5th cause of death, but it's still the #1 cause of disability.
I'm sorry, talk me through that again. Face,
arms, speech, and time. So facial droop. Arms may drift. You put your arms out, one will drift on, or you can't even lift it up. Speech, you may have difficulty pronouncing the words, or you can't even get them out. You may be totally mute, or what you are saying sounds confused. It's not always confusion, but you can be confused also. And time to call 911.
And I'm going to try to bring this back around because we're just about out of time. Now, that information then becomes significant, not just for you, but if you see that in someone else.
Absolutely, absolutely. Because oftentimes the person who's experiencing the stroke, they might recognize that there's some difficulty, but they may not fully recognize that that is, you know, an alarming sign that they need to call 911. So oftentimes it's somebody around them, you know, a friend or a family member who says, like Audra's, you know, what's wrong with your face? And it's drooping, right? And so the more that we spread this awareness, the more that we can get people the medical attention that they need. I'm
going to let you have the last word. 30 seconds. If there's one thing people should walk away with today, it would be what?
Increase in education and awareness about stroke, and to know that there's a lot of resources and support out there. When we talk about stroke recovery, the #1 factor to increase life satisfaction is support. So as Kathy was mentioning about the stroke support group, don't be afraid to seek it out. It's there.
Absolutely.
And if you don't want to do that, there's other online resources or other places to go.
Great. And we're going to tell folks about that in just a minute when we come back, so don't go away when the Lynn Hayes Freeland Show continues.